As today marks International Nurses Day, the Health and Allied Workers Indaba trade union has vowed to boycott the commemoration, citing the unfavourable and challenging working conditions as a result of rampant corruption at the hands of government. The union says the state of the country's healthcare system forces them to compromise their pledge to duly serve patients and the public with professionalism and dignity. We are now joined by HAITU President Rich Sicina now to expand more on this. Good morning, Rich, and thank you so much for your time. You've raised quite a number of very significant issues in the statement, but first and foremost, in the statement that you released on the 9th of May. But first and foremost, you've said that if Florence Nightingale were to walk through the wards of hospitals in South African public hospitals, to be specific, that she would weep. Tell me why.
Thank you for having us, Masishaba. Salute to everyone who's watching from home. You know, Masishaba, under normal circumstances, we're supposed to be celebrating this day and calling ourselves heroes and stuff like that. But when we get into our wards, what annoys us most is that these celebrations, Masishaba, they usually take 2 to 3 hours. But after that celebration in our respective facilities, you go back to the ward, you are still going to face the exact gross shortage of staff. You are still going to go back to a ward where you are 40. While you are nursing 40 patients and you are only 3 on duty. That is what we are saying. If Nightingale can come back and see how this nursing has been practiced, I really don't think that she will like that. And we were supposed to look at 3 things, Masishaba, before we say let's celebrate these heroes. Like there is gross shortage of staff, gross shortage of material resources, and also buildings are dilapidated. You get into the ward, taps are not working. You get into the ward, there's no tissue paper. As we speak now, Masishaba, as we speak, not only in Gauteng, in KZN as well, in many provinces, there's no photocopying machine. We don't have a cartridge. We are told that it was ordered, but it was never delivered because there's no money. You ask yourself, what is it then that how are we going to work? How are we going to nurse these patients with due diligence? When you wake up every day, you know you are going there. It's demoralizing. Myself, I'm one of those people, and nurses who are very dedicated. I love nursing in the true sense of things. But yeah, when sometimes myself, losing it in my line of duty, you ask yourself what happens to others who are doing it because there's nothing else they can do. So we say there's nothing to celebrate.
All right, and let's break that down a little bit further now. You speak of rampant corruption, mismanagement, and general careless attitude towards nurses. Let's talk about the corruption that you speak of. Would you care to elaborate on that?
It starts with the ANC, Masishab. It starts with their policy, the tendering policy. That policy is actually killing the system. We all know that this tender system, it was implemented or it's done so that they can actually pocket. They can actually take some of the money that was supposed to assist us into their own pocket. For example, now when I'm talking about the fact that we don't have cartridges, it's a simple thing. You just have to go where these cartridges are sold and then you buy. But we can't. That is why we don't even have money to buy them, because it's a tender that is in place.
So as a result, where is the money? Where is the money, according to your knowledge?
According to our knowledge, Masishaba, is the austerity measures. I think that's where we need to start first. Besides the corruption, but the austerity measures, the budget cuts that were instituted into the Department of Health, they really affected our funds in our healthcare facilities. Number 2, there are litigations. And these budgets that we are usually given, hospitals or different facilities have to cater for those particular litigations. If we are given 40 million to take care of yourselves from financial year until the end of financial year, and you need to cater for litigations. If you have 11 million that you need to pay for litigations, then how much you are left with? That is why by June or July, the hospitals don't have money completely. There's nothing. to even to buy food for that matter, or buy bread for that matter. And also there are simple pockets then from those in positions of authority, politically in particular, that the corruption starts there.
All right. And in your statement, you've also mentioned the fact that nurses are unable to afford decent housing or to take their kids to decent schools. Are nurses underpaid in South Africa?
Yes, absolutely. And nurses, we are living from hand to mouth. We are getting poverty level salaries. That's what I always refer to it. I refer to it as a one-day tournament salary. You can't go to school, Masisaba, study for 4 years. A very torturing process. We are studying for 4 years, and we are going to be a professional nurse. Then you come into the system. As we speak now, during your payday, on your payday, you are going to take home your 16 to 17,000. And you are a breadwinner where you are coming from. You studied like anyone else. And your peers, by the way, within the same healthcare system, who studied for 4 years, but maybe they are doing other, your dentist, your physiotherapist and stuff like that. We study for 4 years, all of us, and they get 4,000 more than you. We are not saying that they must not get that particular amount. We are saying, why treat nurses as if they are step kids of Department of Health? It's worse now. I'm talking about.
Let's talk about the Department of Health. Have you formally escalated your grievances as a union to the Department of Health? And if so, what has been the response?
We have done that, Masitaba. We have written endless emails. We march to Department of Health in different provinces, but there's no political will. There's no political will. Those in positions of power, politically in particular, they don't care. They don't care because obviously they are not the beneficiaries of this public healthcare system. When they are sick, they go to private sector because they do have a medical aid. And private sector, we all know in terms of resources, it's well off. So I think that is why at some point we were actually saying, as health and allied workers in Indaba trade union, let's abolish medical aid. Everyone who is in parliament, everyone who is in a position of power within Department of Health must never have medical aid. They must attend these so-called facilities, public healthcare facilities, so that they will see what we are seeing, so that they will listen to us when we say, let's fix the issue of gross shortage of staff, let's fix the issue of gross shortage of material resources.
So as you say, you are boycotting this International Nurses Day today. What does that boycott look like? How do you intend to boycott International Nurses Day today?
It's not an easy thing to do. It's not an easy thing to do, obviously, because our people on the ground, members we are representing, they are not as brave as some of us to say we look into a situation where if there is an organization or there's an event that looks to celebrate nurses, let's not attend that. Those who want to go there, yes, that is what we want to do. If there is an event in our facilities, we are not going to go and attend those events. And ourselves as an organization, we have the power. We always prepare and organize these events. But this time around, we are not going to do anything.
All right. No, thank you so much for your time, Rich. That was Health and Allied Workers Indaba Trade Union President Rich Sicina, who is basically talking to us about the fact that HAITU is boycotting this International Nurses Day today until hopefully their grievances will be heard and maybe something will be done.